So, Mr. Pedersen, do you think, seeing what happened with the coronavirus, AI and robotics will be used more in the healthcare sector in the future?
What we see now, I think, will change society forever in a lot of different fields concerning taking or using new technology. We see it, people are working from home, new technologies are being developed parallel in many countries in the world today to develop vaccines. And of course, they are using new technologies like AI and other. So I think this is, I had a colleague here one day that said that he thinks that this will jumpstart or make us jump 10 years in time in digitalization in our country. So that is how huge this change will be,
Because
in
the
my opinion.
incentive to adapt to the new situation.
Sorry.
Because of the incentive to adapt to this new situation of a pandemic.
Yes, because everything is now put into to battle the epidemic, and it's also it's a lot of resources being poured in. A lot of scientific heads are sitting together working on this issue, and also a lot of private companies, computer companies. Everyone is working together to get this happening, and that is a very good thing, I think, in spite of this being a huge problem for many people and a pandemic.
And Mr. Kraft, what are you thinking about how this will change how we work, how we think, how we carry on our lives in the future?
Well, definitely, with the experience that millions are now working from home, this will change our working style and working methods and the collaboration. But I would also like to add some thoughts about AI and detection measures. I think it is obvious that we lost time by late detection in a couple of countries. And so I also could foresee that we will have a new discussion about syndromic surveillance and comprehensive syndromic surveillance that will allow us to get earlier signals for outbreaks and unexpected situations. And here again, artificial intelligence will play a major role in helping us to support to identify early signals from comprehensive syndromic surveillance. And then there's another issue that I just, the other day I read a very interesting report from my colleagues from the Chinese Academy of Science, the Institute of Geographic Sciences and Natural Resources Research. They have done a study on GIS, Geographic Information Systems, and big data as a support tool for managing the outbreak. And I think this is also, we will see a revolution in these technologies because they really help for containment and for controlling the situation.